Well, our 9 health expert, Dr. Paul Coley, is with us now. Do you agree with Dr. Jha as far as the right metric being hospitalizations as far as this part of the pandemic?
I don't agree. Not at this phase in the pandemic for a few reasons. One, it's a lagging metric. We know that. Second, when we're vaccinated, we know we're less likely to end up in the hospital. And then, third, with Omicron, especially even with BA2, we're seeing fewer and fewer hospitalizations, more outpatient illness. So even though it's an important metric in terms of, the worst case scenarios, we still should track it. I don't think we should be making all of our decisions based on hospital capacity.
I mean, that feels like it was more like October and January when we were thinking about that. But so then you also look at like Philadelphia, where they have based, they've seen these hospitalizations rise and case counts as well. They're bringing back the indoor mask mandate for that very reason. Is that a good decision?
Yeah, so I think Philadelphia has a really proactive approach rather than the reactive approach that we have had all throughout the pandemic. So they're anticipating infection begets infection, right? And now the BA2 is much more contagious than the BA1. So it's just a matter of time before those infections will start to exponentially grow, especially in the phase of waning immunity, because we're all coming out of the Omicron surge of January, and it's now summertime when those antibodies start to go down. So I think it's a really good approach. I think we should start looking at things like wastewater as well as the emergence of new variants to really help us understand what's happening with infections, because a lot of people are doing home tests and they're not showing up on that positivity rate.
They're not reporting, they're not,
What about the mask mandate as far as air travel? Because that seems to be a very important hump, if you will, to be on one side or the other of that. It seems like everyone was heading in the direction where the masks are coming off. Do you think we're going to have the masks off come Monday?
I think we might, but as somebody who travels almost every week, I'm really nervous about that, because there's something unique about air travel that's different from a restaurant, which is that people come from everywhere and people are in contact for a long period of time. And yes, there's recycled air and everything, but it's not science that's pushing them to take the masks off in the planes. It's the business side of it from the airline CEOs, and it's people's personal preferences. Because we know that respiratory illness goes down when you're wearing a mask on a plane, regardless of whether it's COVID or not. We also know that as infections go up and you have a more contagious variant, you're going to get more bang for your buck by wearing those masks on planes.
Plus you're sitting right close to each other. So the White House had an event recently that resulted in 72 positive COVID cases. So is this just like, are we going to hear about this all the time now? Is this the thing? Like, okay, big event, guess what? 50, 60, 70 new cases?
I was shocked to see that, because the White House has the most strict COVID protocols. They do testing, they do vaccination, they do boosting. And despite that, the virus broke through. And so that really should be attesting to just how contagious this virus can be and just what we're in for if we start to kind of open the floodgates. Now, as we sort of acclimate back with the virus, I do think we're going to see events leading to illness, which is why testing is going to be real important after we get together, after we travel. I encourage everybody to do that. I do that myself. But to me, that was a shocking number.
We have seen the variants move geographically. Is Philadelphia, is Washington, are they telling us, are they pointing to our future here in Denver and in Colorado? And if so, what do we do? What can we do individually, each person?
We have already seen so many counties here in Colorado have their case counts go up. So like I said, it's just a matter of time before we get more. But I think now, Tom and Kim, we're at a different place than we were 2 years ago, because we know how to fight the virus. We've got great therapies, great vaccines. So the biggest piece of this, of course, is get vaccinated or boosted if you're eligible. If you're over the age of 50, go and get that 4th booster. Only 70% of Americans have even gotten that, 3rd booster shot that they were supposed to get. So go and get that as we prepare for the summer, and then really start individualizing and assessing your own risk, because it's not coming top down anymore. So you have to take control.
And start testing again, maybe more regularly than you may have fallen off to where you don't test at all or infrequently now.
For sure, and not just testing for symptoms, is it allergies or is it COVID, but even surveillance testing. So what I did the other day is I had a COVID test that was going to expire in a week.
So you used it?
I used it.
Right.
And I said, I've been seeing people, I've been going out to dinner, so let me see what happens.
Well, we'll see what happens for sure. Everyone will be watching. Dr. Paul Coley, thanks.